important. Dental health. It's something that matters to all of us. I'm Lynn Alexander, and I am excited to be your host for this live show. We've got a great show lined up, and we'll be talking with Dr. Kumar Vadivel, also known as Dr. V. He is a super smart dentist who knows a lot about teeth. He's going to tell us about the newest things in dentistry, how to keep our teeth healthy, and ways to get dental care that doesn't cost too much. Whether you know a lot about teeth or just want to learn how to keep your smile bright, you'll find something interesting here. We'll cover many topics like why brushing your teeth is important and what's new in dental technology. We've already got some questions from our viewers, and we'll answer them. Plus, you can ask more questions during the show. Before we start, let me tell you more about Dr. V. He's not just any dentist, he's a periodontist, which means he's an expert in certain types of dental care. He works at ToothHQ Dental Specialists in Dallas-Fort Worth area in Texas. And guess what? He's even writing a book that's coming out this year, correct?
Yes, correct. Yes. Yeah.
If you want to know more about Dr. V, check out our website at www.mytoothhq.com. So let's get comfortable and ready to learn lots of cool stuff and about taking care of our teeth. Let's begin our dental live show. Welcome everyone, and now let's welcome Dr. V and start our show.
Hi everyone, I'm Dr. Kumar Vadivel, or Dr. V. I'm very excited to be here today. As you guys know, I'm a board certified periodontist, and thank you, Lynn, for the introduction.
Absolutely.
I specialize in treating gum and bone disease and placing dental implants and performing oral surgery as well. I'm with the American Academy of Periodontology and the American Board of Periodontology, and I founded ToothHQ Dental Specialists with 4 locations in the Dallas-Fort Worth Metroplex in Texas, and we really focus on bringing or providing healthy gums and healthy teeth and replacement teeth using dental implants. I'm here to answer any questions, and thank you for being loyal followers and loyal viewers. And we are going to talk about dental health. Ask them live, or if you have any questions for our next show, post it on our website or on the social media, anywhere you can. That will help us improve our show. And if you enjoy our content, and as you guys know that you do, please give us a great feedback, like and subscribe to our channel, and for any updates on any dental health tips also. We look forward to your questions and helping you achieve your best smile. And let's have another great show.
Okay, well, I'm going to start here with some questions that our viewers have already sent in. So we have a question regarding implants. Does ToothHQ provide dental implant services? And if it does, what kind of dental implants does ToothHQ offer? Additionally, is there insurance coverage available for dental implants at ToothHQ?
Great question. So the multiple parts of the question is, do we offer dental implants at ToothHQ? And is there any insurance coverage available at ToothHQ for providing the dental implant services? I'm assuming that when you're talking about the dental implant services, either you may require a single implant, or you may require one or two or three implants to replace a few missing teeth, or you may require all teeth to be removed and replaced with the dental implant. No matter what type of implants you require, we offer those at ToothHQ, and we'll happy to see you. It sounds like you are in the Dallas-Fort Worth area. As you know, we got 4 locations. We are happy to serve you in any location of your choice. And to answer your second part of the question to whether we offer insurance coverage, absolutely we do. So any type of insurance you may have, call our office, and visit our YouTube channel. You will be able to find or if you're watching live show, if you're watching this live, Google mytoothhq.com, and we'll be happy to see you. As you know, if you can tell them about the free consultation we offer.
Yes, we
Elaine?
do. We have a free consultation and free CT scan. So coming in to just get a quote and finding out what we recommend is doesn't cost you anything. And from there, we will take it and if you give us your insurance information, we'll see what kind of benefit that you might have through your insurance company to help you with that a little bit.
Fantastic. And we look forward to seeing you.
All right. So on to our next question. What are the different methods available for teeth whitening and which one would you recommend, doctor?
So the question is, what are the teeth whitening options available, from simple to the complex option? The simple option is you don't have to really come to see us, or you don't have to go see a dentist to do the tooth whitening. You can do as simple as buying a whitening toothpaste, or you can do some bleaching agents you can buy from the store, and you can use some whitening strips that you can use from the store. So there are multiple options available, and these are, we call it either over the counter, or we call them as at home options. And speaking of the at home options, your dentist, when you go to them, and they are going to possibly give you some kind of a tray, a custom tray that they are going to make, and then they are going to give you some medication. These you cannot get them from the store, and because these are a little bit stronger, and we don't want any DIY. Many people, if you guys don't know what DIY means, like do it yourself. There is no DIY, because you may have extensive gum disease or extensive cavities, and you may end up actually doing more harm by doing these DIY stuff. So particularly with these, other than the over the counter stuff, um, people buy some crazy things sometime online, and then they use it, and they actually end up causing some damage.
Mhm.
So your options are buy some over the counter, or talk to your dentist about doing some at home bleaching options with some custom trays, or your dentist can do some whitening within like about an hour or so in their office, for example, like Zoom whitening. So talk to your dentist, whoever it is, or if you happen to be in the Dallas Fort Worth area, come see us, and we'll be happy to help you.
Absolutely. So our next question is, hello, Dr. V. After my dentist drilled my last molar and filled it with calcium and another material, I've been experiencing continuous noise from my left head and sometimes from my left ear. What steps should I take to address the issue?
Well, it looks like or sounds like you recently had a filling, or some kind of a filling, which you are referring to as a calcium filling, and I'm assuming it looks white, and that's possibly the reason why you're calling it as a calcium. So it sounds to me like you probably had a temporary filling
Mhm.
your dentist might have put in, and it is very possible, depending on how old the filling is, there is a very good possibility the filling may be even moving, or part of the reason why your dentist may have done this type of filling is because the cavity was extending too far into the tooth, and then they could not put a permanent filling. So my recommendation is it could be as simple as the filling kind of moving on the tooth, which you could be feeling it on your ear or when you're biting down, and that is what you may be feeling. My first recommendation would be that you do go see the dentist, and then make sure that tooth is not going to keep breaking and you're going to end up having to remove the tooth. And if that doesn't solve the problem, if you truly have any kind of ringing or any kind of a noise in the ear, there could be another reason why you may be grinding your teeth. People like this, they grind their teeth, and sometimes they hear the clenching or the clicking in the ear. If
Mhm.
you're experiencing something similar to that, again, talk to the dentist, and they can really help you. Or if none of these like apply to you, if it is truly a problem with your ear, then you will need to talk to a dentist about possibly you having to go see your primary care physician, and either your primary care physician can help you, or you may even need to go see what we call it as an ear, nose, throat physician, and to really find if there is a problem with the ear.
Right. Thank you so much. It was very, very informative. Let's see. Hello, Dr. Vadivel. What is the cost of a dental crown at ToothHQ, and does insurance typically cover this procedure?
So, what is the cost of a dental crown? What they mean by a dental crown is when you have a tooth that is completely kind of broken, or it is broken to the degree that a small filling cannot help. So, then we grind the teeth and we place a tooth on the top of that. It's like almost like a, sometimes people call it as almost like a jacket, like this. So you need a crown to be put on a broken tooth. So do we do this at Tooth HQ? We do offer that along with our referral partners, and if it is anything implant related, this we do it in our office. So to second part of your question is what is the cost of that? Depending on the coverage or the dental insurance you may have, the dental crown cost as low as about $600 to $700, as high up to about 1,000 or $1,500, depending on the type of crown and the material that we are going to use. So again, wherever you are, whichever part of the country you are in, talk to your dentist and they should be able to help you. And sounds like you are in the Dallas Fort Worth area, so come see us at Tooth HQ. We can definitely help you.
All right. Thank you, Dr. Vadivel. I underwent a root canal procedure on a molar 20 years ago. Presently, the other root is inflamed. Is it possible to have that root removed, or will I lose the tooth?
So the question is, this sounds like this viewer underwent a root canal procedure about 20 years ago, and the root is inflamed. So I'm not sure whether you've recently seen a dentist or you are calling yourself and saying that the tooth is inflamed. And if the root is inflamed, and if you got the root canal done, and if the root canal is 20 years old, the chances are it could be failing. We always say the root canals are like a ticking time bomb. I've seen root canals last 50 years. Sometimes, they don't last like a long time. And actually, matter of fact, I saw a patient in my office today. She had the root canal done less than a month ago, and she was still kind of in pain, like, less than a month out. And she just had a crown placed like about 2 weeks ago. She was in so much pain, and she said, I'm almost done. So she had other extractions to be done. She was referred to my office, and she was almost done with the pain, and she was in so much pain. I tried to tell her, hey, you only had it for about a month, and you already invested money on getting the root canal done. You just got a crown done like about 2 weeks ago, and I to tell her like, hey, you need to really keep the tooth. And so she decided to keep the tooth. Um, so if it is a recent root canal, absolutely keep it. But sounds like you had it for about 20 years, and your investment is worth now about 20 years. And I would say it looks like inflamed. Talk to your dentist, and if the tooth needs to be removed, so be it. Absolutely, your dentist can remove the tooth and replace the tooth with a dental implant for you. And to answer your question, will you lose the tooth? Of course, if it is served for about 20 years, my recommendation is if it is not salvageable, and let the tooth go. And we got some great teeth replacement options such as dental implant, which is going to look, feel, function like a natural teeth to give you that natural tooth back.
Absolutely. All right. So, hello, does Tooth HQ provide cleaning and filling services? Also, what is the cost of the consultation? Um,
I think you can take that question,
yeah, I
right?
can. So, uh, absolutely, we do provide cleaning services. Fillings, We can help you find a family dentist, a general dentist that will help work with you to get those done. As far as the consultation here in our office, I answered that earlier. We do free CT scans and free consultations here in the office for all of our new patients. So if you're in the Dallas-Fort Worth area, please go ahead and give us a call, and we are happy to get you in.
Just to extend on the cleaning, on the type of cleaning that
Mm-hmm.
we do. So, whenever you are getting a cleaning done, there are two types of cleanings that you
Yes.
need to be aware of. One, we call it as a regular prophylactic cleaning, which is like if you have really, really no gum problems and you have healthy, perfectly healthy teeth, which is what you're going to require, which is what you're going to get mostly when you go get see your dentist.
Every
But it
6 months.
absolutely every 6 months. That is correct. Thank you for reminding
Yep.
me on that, and thank you for reminding everyone on that. And then when you have gum issues like our gum problems, our periodontal disease, and your dentist are in our office, and we are going to recommend you get your cleanings done
Every
every
three
3 months.
months.
Exactly right. So on those every 3 months, and we call them as not like a regular cleanings anymore. We call them as a periodontal maintenance therapy. What that means is we are going to help maintain your gums and maintain the health of your gums by doing this periodontal maintenance therapy. So you need to come see us every 3 months in that occasion. So either 3 months or 6 months, your dentist will be able to help you. And again, if you happen to be in the Dallas Fort Worth area, come see us and we can definitely help you.
And when we do the 3 months, Dr. Vadivel, just for clarification for our viewers, it is because that bacteria that creates the gum infection, the periodontal disease, its life cycle is 90 days, and we want to stay ahead of it,
Absolutely,
correct?
actually less than 90 days, yeah, but 8 weeks or so, we can't practically be doing cleanings every 8 weeks.
Right.
And although I joke with my patients all the time, hey, how often do you get your hair cut, right? So we definitely would like to see you every about 8 to 12 weeks.
Mm-hmm.
8 weeks is not literally practical, so that's why we kind of set a bar at least every 3 months.
Mm-hmm.
And speaking of that, in our office, we also offer not like a regular cleaning. Whenever you are going to come back for our periodontal maintenance therapy, depending on the condition or the status of your gums, and we also offer additional laser during these maintenance therapies. So you get to control the bacteria that causes the gum disease. So
Right.
we help you maintain your gums healthier. Absolutely.
Absolutely. Thank
Yeah.
you. All right. So our next question says, "Hi, doctor. Is it true that fluoride is considered a neurotoxin, and is there compelling research indicating that higher fluoride levels in a community's water supply are consistently linked to lower IQ levels?"
So so what the viewer is asking uh, is high fluoridation level in the community water related to the low IQ. So it is kind of a myth, and it is one of the common questions people ask. And whether if your intake of fluoride is higher, then it is related to a lower IQ. And we have seen in multiple studies and over the higher fluoridation is not related to a lower IQ. and and in medicine we call it as what we call it as a meta-analysis, which is a consolidation of multiple studies we look at, and then we come to a conclusion whether a particular condition is related to another disease or something. So there are multiple meta-analysis studies that have consistently proven that higher fluoridation is not related to a lower IQ level. And I hope I answer this question so you don't have to worry. Again, talk to your dentist whether you do have any fluoride related damage, and they should be able to help you, and you don't have to really worry about that.
Awesome, thank you. It looks like we have a live question that has come through, so I'm going to read that one to you here. Give me 1 second. Okay, can laser gum treatment be used for patients with dental implants or other dental prosthetics?
So, can laser gum treatment be
be used for patients with dental implants or other dental prosthetics?
So, can laser gum treatment be used for dental implants or any other prosthetics? And great question. So,
Hmm.
matter of fact, like the patient that I treated today, he had a complete full mouth periodontal disease. So, and his disease was completely advanced to the degree even laser could not help. And I talked to him. He had come in like about 2 or 3 weeks ago. Patient was on aspirin, so we had to really stop the aspirin actually about exactly a week ago or 10 days ago. So we had to stop the aspirin and we had to take him off the aspirin about 7 or 10 days, and we performed the surgery today. He had uh, natural teeth all the way except for the two front teeth. He had he had dental implant. So I had to do the conventional surgery, and then I ended up doing laser on those two dental implant. As a matter of fact, we prefer the laser on the dental implants to cause any more damage or any more gum receding. Otherwise, if you end up exposing the implants or the metal surface, sometimes it could be detrimental. So we recommend doing laser therapy for dental implants. And in our office, as you know, we carry two types of lasers. One is we call
Yes.
it the LANAP laser or the LAPIP laser, and the second one is a BioLase. And
Hmm.
we use those two types of lasers depending on whatever the recommendations are. When we see the patient, we will use either one of those lasers. And then if you have any other prosthetics, and it doesn't matter, we can still help you with the laser therapy, even if you have to wear other type of prosthetics. Yeah.
Right, because when you have prosthetics or the implants, it's actually just as important, if not more important, to keep those clean, when you're so that you don't lose everything that you've invested your money into on those implants and the especially like an all-on four or all-on six denture that's retained just by those implants. You have to keep them healthy as well.
Absolutely. And remember, you talked about like the bacteria, right?
Hmm.
Like to control the bacteria with the laser. So that is exactly what we are talking about. There are some occasions, when you have a completely fixed teeth, and what we call it as an all-on four or an all-on X type of prosthesis. When you have those, it's almost impossible for you to remove those, and your prosthodontist or the dentist can remove them, and sometimes it is impossible for you to reach some of those hard areas. So in those cases, when you come back or return for, in this case we are going to call it as an implant maintenance therapy, not periodontal maintenance.
Hmm.
So on those implant maintenance therapy, we use the laser to keep or maintain the gum health, and in addition to control the bacteria as well.
And usually the implant maintenance therapies we do about once a year, right? At least
Um,
minimum
uh,
once a year.
at the minimal, once a year. Once a year, we remove the
Yep.
prosthesis to replace them. But again, going back to what we talked about, the
The
bacteria
3 months. Hmm.
recontaminating, so that has to be done every 3 months. So what Lynn is asking is, when you have a prosthesis like this and you cannot remove, and how are you going to be possibly keeping that clean? So we do the implant maintenance therapy every 3 months, and followed by and along with the laser, and then once a year you remove the prostheses and put them back, clean them, laser on them, and put them back.
All right. Thank you.
Awesome.
All right, so our next question is a root canal treatment truly necessary for a 3-year-old child's upper molar baby teeth? Could this procedure impact the development of their permanent teeth? Is there any risk involved?
So, is a root canal treatment necessary for a 3-year-old person, and whether is this going to be affecting the development of the permanent teeth, and is there any risk involved? Um, uh, I'm not really sure, like whether we are talking about like a complete root canal on that baby tooth, or maybe they're removing the top part of what we call as the nerve, and we call it as a pulpotomy. So whether they are going to do that, no matter what it is an absolutely safe procedure, and you are going to be seeing either your dentist or possibly who we call it as a pediatric dentist to do these type of procedure. and it is an absolutely safe procedure. And speaking of, any kind of a damage it will create to the permanent tooth, absolutely not. Again, talk to your dentist or your pediatric dentist, and they should be able to answer that. But I can tell you, it is a definitely a safe procedure. It is not going to hurt your permanent teeth. And if you do require that, and your dentist or the pediatric dentist should be able to recommend that for you.
Yeah, and the molars, the primary molars, the baby teeth, they stay in until the permanent teeth come in.
That is
So it
exactly
holds the
right.
spots for those, and the molars don't come out for a while. The front teeth come out first. So
Absolutely correct. Yeah. So what Lynn is saying is, you need to retain those, and you don't want to prematurely remove them. Then that's just going to impact the development, or the what we call it as eruption. So when the teeth come through, if the space is closed, then the permanent teeth will not have space to come through. So you want to retain the space. So if your dentist or the pediatric dentist recommended you do a root canal, my recommendation is absolutely do that, and that will help maintain the space.
thank you. All right. So next question is, could you please provide the cost for complete teeth cleaning?
Do you
That's
want to take that?
Well, that's kind of a loaded question there, because a complete teeth cleaning can mean a couple of different things. It could mean the regular prophylaxis, like what you explained earlier, which is above the gum line, that for teeth that are healthy and there's no periodontal disease involved. Um, and then it could go to the next level of a periodontal maintenance that we do every 3 months. And then it can go to deep gum therapy, or what a lot of people call a deep cleaning, or scaling and root planing. And then the even further than that is our osseous surgery
Or the
cleaning,
laser
the laser
assisted deep gum
assisted,
therapy we
yeah.
do, right?
So those all have different costs because of the degree of however advanced the patient's care needs are. So it can range anywhere from $150 on up to several thousands, depending on what the patient needs. And we
Absolutely.
always have ways to help them find a way to put it into their budget.
And it may not cost anything at all if all
Mm-hmm.
you require is a prophylaxis,
Yep.
and most of the time it is going to be 100% covered by the insurance. And so if you do have insurance, then definitely talk to your dentist, and then they should be able to help you. And again, if you have insurance, and all it needs is you go visit the dentist, right? So once you visit the dentist should be able to do what we call it as a comprehensive periodontal exam. They are going to measure your gums, and then they are going to take a bunch of x-rays or possibly a CT scan to evaluate the gums, and then recommend whether you need a regular cleaning or a periodontal maintenance cleaning, or a scaling and root planing, or the deep cleaning, or extensive osseous surgery. And your dentist should be able to answer this question.
Awesome, thank you. All right, is it safe to have deep tooth cleaning using either laser or conventional methods while being treated with Prolia?
Great question. So what the viewer is asking is whether it is safe to have a deep planing, which we call it, which Lynn said, it's a scaling and root planing, or to have a laser along with this conventional methods when the patient is taking Prolia. So Prolia is a drug most of the time the women take, and it is for osteoporosis. And when you take osteoporosis drug, and the surgical procedures are a little bit riskier, because you are going to have the bone kind of like a little bit of a spongy bone, we call it. And anytime you do some kind of a surgical procedure, the bone does not heal properly.
Mm-hmm.
So, and in that case, you absolutely want to do everything that you can to keep your teeth safe. And that's where it goes back to, you need the deep gum therapy and you need the laser therapy. My recommendation would be to consider deep gum therapy and laser assisted gum therapy, because you want to reduce the risk of any kind of a contamination. And to answer your question whether it is safe to have a deep gum therapy or laser gum therapy, it is absolutely safe for you to do so. Again, depending on the medical condition of your body, your dentist or the periodontist should be able to recommend the right treatment for you. And if you happen to be in the Dallas-Fort Worth area, come see us and we can definitely help you.
Absolutely. All right, so we actually have a viewer appreciation. We had a very nice thank you from one of our viewers, so I'm going to read that here. Um, it's regarding a video about avoiding nerve damage in wisdom teeth. The viewer says, "Thank you so much for your good advice. This was this was my question. After discussing my case with a colleague, the dentist decided that he wasn't confident to remove the tooth. They referred me to an orthodontic surgeon, but she said that I would need mild sedation as my heart is in atrial fibrillation permanently. So now I am waiting for an appointment in a hospital. I am happy for the moment as the strong antibiotics cleared the infection and the pain is gone for now. When I see the hospital surgeon, I will ask about the coronectomy. Yeah.
Coronectomy.
Coronectomy. Thank you. You are very good people. Well, that was very nice.
Yeah, thank you. Thank you wherever, whichever part of the world you are. And we really
Absolutely.
want to thank you and thank you again, all of you guys who are watching the show. And thank you for being loyal followers. And I'm so glad, like, we were able to help this patient. We are happy to help any patients, anybody who may have dental health questions or any dilemmas you may have about your dental health. Post your questions and we are happy to help you. Thank you again for the nice comment.
All right, we have one more question that came through our live feed here. Can periodontal health affect sleep apnea, and if so, how?
So the question is, can periodontal health or periodontal treatment help sleep apnea? And if so,
How?
how? Correct? So great question. And again, true story. We always, and anytime these things happen, we always have like a walk-in example.
Yes, we
So
usually do.
today we had a patient, 23-year-old, 23-year-old. You can't imagine, she has periodontal disease and she has what we call it as an overjet, meaning like the teeth are kind of a little bit this way. She was concerned about the profile. Her teeth were kind of pushed back inside on the bottom, and the upper teeth were kind of like a little bit bucky. She is concerned about the overjet, and she snores, and she has periodontal disease. So, and she's a college student, and she is an undergrad. She, as I said, she's only 23, so she is a college grad. She's a fresh grad, and she just graduated. We are in Dallas, and she graduated UTD, University of UTD Dallas, right? University, yeah. Okay, I forget the acronym here. So UTD Dallas, and she went there, and she just graduated, and we talked to her about the common denominator for everything. So the common denominator for everything here is the inflammation. So the inflammation is the common denominator which causes the periodontal disease. Inflammation is the common denominator. It causes variety of diseases, including sleep apnea, heart disease, or lung disease. You go talk to your doctor, and they are going to tell you inflammation is the common denominator. So if the periodontal disease caused some kind of an inflammation, it could very well possibly be causing the sleep apnea also. Again, treating periodontal disease, would that help to control your sleep apnea? And I'm not going to say, oh, treat your periodontal disease, your sleep apnea is going to get better. But think about this. The common denominator is the inflammation. The more you're going to reduce the inflammation, the better your body is going to respond. So when you control the periodontal disease, you're going to reduce the inflammation, thereby you're going to reduce the risk of sleep apnea. So there is always going to be an association. So talk to your dentist whichever part of the country you are in. If you happen to be in the Dallas-Fort Worth area, come see us, and we can definitely help you to control the periodontal inflammation thereby helping you with your sleep apnea.
Great. So now we're going to do a fun little thing here. We're going to do some rapid fire questions and please answer within 1 to 2 sentences only.
Okay, will do.
So here we go. You ready?
Yes.
How can one prevent dental erosion?
To prevent dental erosion, control your sugar intake, control the way that you brush your teeth, control the way that you are going to limit your soda, and control your diet. Multiple things you can do.
Okay. Can my oral piercing lead to dental problems?
Absolutely. Can your dental piercing lead to dental problems? It can lead to multiple dental problems, and it can cause cavities, and it can cause periodontal disease. It can even cause extensive teeth damage to the degree that you're going to end up losing your teeth.
Yes, it can. Which types of medications can aggravate mouth dryness?
Which type of medications can aggravate mouth dryness? So any medication or any, you got to read the fine print. Most common medication that we see are the high blood pressure medication, or antidepressants, or anti-diabetic medications are the most common ones that we see. But of course, any medication can cause, and talk to your provider.
Are there any genetically transmitted dental conditions?
Are there any genetically transmitted dental conditions? And we had a seminar last night, as you know.
I was there.
We were talking about what causes oral cancer. So, including many common dental conditions, and dental cavities, or periodontal disease, or even oral cancer, or any other dental conditions that you can think of. They can have a genetic component to it. So again, any type of disease you may have, talk to your dentist, and they should be able to confirm whether there is a genetic connection or not.
Okay, last rapid fire question. Can stress affect my oral health?
So the question is, can the stress affect oral health? Absolutely, stress can affect the oral health. And as you know, again, going back to any condition that you can think of, dental cavities, or periodontal disease, or even sleep apnea, these all can be caused by stress. Absolutely. And grinding, right?
Mhm.
Yeah, right.
Yep. All right. So back to our questions from our viewers. When is it absolutely essential to get a dental crown?
So the question is, when is it absolutely necessary to have a dental crown? That depends on the damage you have on the teeth, and your dentist should be able to answer your question. And for example, when you have a tooth, and when you have a small cavity, then it could be as simple as, they can apply some fluoride and you may be okay. When you have a little bit of a larger cavity, as you know, that you need a filling, a small filling. When you have even a little bit larger cavity, you may need an extensive filling. When you have even a larger cavity, then you need a crown. So it depends on the degree or the extensity of the damage. So a lot of things that your dentist is going to do: a clinical exam, and look at the extensity of the cavity, and do an extensive evaluation using a radiographic exam, and your dentist should be able to help you.
Awesome. All right, we have another question from a live caller. So it says, "Hello, doctor. I'm a 27-year-old, and I have 4 wisdom teeth. Will all 4 wisdom teeth need to be removed, or only the problematic ones? I plan to remove them this spring break. Does ToothHQ offer any wisdom tooth extraction offers?"
Okay, so we just talked about a 23-year-old. This happens
We
to be a
did.
27-year-old, right? So the question is, I have 4 wisdom teeth. Do all 4 wisdom teeth need to be removed? Although they may or may not have, all 4 of them may not have a problem. And do we offer any type of specials, because this patient needs to be on a spring happens to be on a spring break? Exactly the same thing that happened to the patient that I talked about earlier, 23-year-old. In your case, you are a 27-year-old, and this patient had an extensive pain on one of the bottom right side tooth. a little bit of a discomfort on the bottom left side, and there was absolutely not like a cavity or anything on the left side, although on the right side she had a cavity, and the two top ones, and she didn't have much damage at all. So we recommended, based on what I saw, remove the bottom left side, and then remove the bottom right side, and then the bottom left side also. And she didn't have any problems on the top, but she was a little bit anxious. And then we talked about the inflammation, and then we talked about the wisdom teeth causing damage to the other rest of the teeth. In her case, in her best interest to be put to sleep, get all four wisdom teeth removed, which is kind of a normal routine procedure that we recommend anytime patients have some kind of a wisdom teeth, particularly younger people. And as you know, in our office, and just like that I said earlier, she is a college student. She is coming back this week, later tomorrow or the day after, to have the wisdom teeth removed with the special that we offer, free sedation. When you have four wisdom teeth, we offer the free sedation in our office, and we'll be happy to help you.
Yeah, that is absolutely. We recommend having all the wisdom teeth out just because they're bacteria traps and they really are not useful to most people.
Absolutely correct. Yeah.
So, all right.
Bacterial factory.
Back to my factory.
Bacterial factory.
Yes, bacterial factory. Yes,
Yeah,
it is.
right. Yeah.
Yes. So we have our next question is, when a bone graft resorbs, where exactly does it go? Is it possible for it to integrate into the soft tissue?
So the question is, when the bone graft, okay, well, what is a bone graft? Let's talk about that first, right? Some of you guys may not know. So whenever you have a tooth removed, we recommend packing that area with the bone to retain the bone structure, so later you will be able to receive either a prosthesis or a dental implant. So what happens to the bone graft? That's what the viewer is asking. So bone graft normally gets resorbed by your own body. That's what normally happens. And what it means is, your own body, it is going to transform that into your own body bone. What happens is, it's a cellular mechanism that happens, and we call it osteoblastic activity and osteoclastic activity that happens in the bone. Your osteoclasts are going to come, remove, or the inflammatory cells are going to come remove these cells, and they are going to go away, and then your osteoblasts are now going to start to form. That forms the body bone, and that's what happens most of the time. And what the viewer is also asking, is it possible some of this bone graft to get embedded or get sent into the soft tissue? If it does, it's not a big problem at all. And as long as the resorption happens for most of the bone graft that is being put in, as long as you have enough bone for you to be able to receive the prosthesis or an implant, you're in good shape. And even it does happen that if it stays in your body, that is completely okay.
I think the way I explain it to patients for them to understand is it integrates. It just integrates with your own bone. It just kind of connects.
Fuses to your own bone.
Together.
Absolutely correct. Yeah. Thank you.
So,
That's a good way to explain that. Yeah.
let's see. Are there any medications available for teeth that have become loose?
I wish I could tell you that, yeah, loose teeth can be fixed with medications. Absolutely, I can't really tell you that loose teeth can be fixed with medication. Medications can help to a degree, that when you have loose teeth, then you can get the deep gum therapy or some kind of a gum grafting to be done, or some kind of what we call it as a bite adjustment to be done to help with the loose teeth. But medications themselves are not going to help. Medications will help as an adjunct, in addition to the multiple therapies I recommend. As I said earlier, the deep gum therapy, the laser therapy, or the bite adjustment. You are going to show something here.
Yes, I think that's a good question to kind of bring up our mouth body connection.
Absolutely, yeah. Go ahead.
Because this is something that when you have loose teeth, there's a reason for it. It's not just because they all of a sudden became loose. There's a reason, and that reason is that you have infection in your mouth, the bacteria that's in your gums that is causing the bone to move away from your teeth, because when you have bacteria in there attached to your teeth, the gums and the bone, they don't like it. They want to get away from it, and so they pull away. They resorb. And so you start losing bone, and that is how come your teeth get loose. And so the way to take care of that, like Dr. Vadivel was just saying, is with the different therapies that we recommend, either the deep gum therapy, the laser assisted deep gum therapy, or the laser osseous surgery. With doing those and then coming in every 3 months, that can control the problem. But that's the cause, is that there's a bacteria in your mouth that's infecting not just your mouth, but it affects your entire body, because it can get into your carotid artery, and it'll go to your heart, your lungs, your kidneys, your pancreas, your brain. It's been linked to pregnancy complications, stillbirths, low birth weights, other pregnancy complications, and then for men, it's been linked to erectile dysfunction, which we all know nobody wants to have that. Um, so it's not just a mouth issue; it becomes an entire body issue, and with that, it also is a community issue, because you can transmit it not just from your mouth. It goes from your mouth to somebody else's. If you have a wife or a girlfriend or a boyfriend, and you kiss them, you're giving it to them, and it may not affect them quickly, but it will eventually affect them at some point. And even children, if you share utensils with children, share a spoon, a fork, a drink, that saliva that gets on those utensils can transmit to children as well.
True story. Shannon and I, we were talking to this patient who came in this afternoon. She has a 3-year-old autistic son.
Hmm.
3-year-old autistic son, and I did not know that she had an autistic son. So we were talking to her, hey, you are a mom, and I didn't even know that she had a son. We were actually talking to her about the mouth body connection,
Hmm.
hey, and the last thing that you said, hey, by the way, it can, you can transmit this to your spouse or the significant other. And then I ended up saying, hey, you can be even passing it on to your children by
Hmm.
mere sharing of utensils. And you know about kids, and when you're eating a lollipop, or when the kid is eating a
Hmm.
lollipop, and you want to take a bite on that, and then when you're at the dinner table, you share the utensils, and then hey, my kids say that, daddy, can I taste this, or
Hmm.
you're going to taste this, from your family. And then she started like having tears, and she said, and I'm so glad you said that, because I do have a son. I never even thought about that. And he's an autistic son. And then she showed me the picture.
Oh.
That was an emotional moment.
Oh
She's
yeah.
actually
I
coming
imagine.
back, for doing all the gum therapy and all of
Yeah.
that. Actually, Friday she is coming back. So that was really an emotional moment for us, and it was an emotional moment for her as well. And then it was, nobody ever told her about this, periodontal disease, and she had extensive periodontal disease. And we talked about the wisdom teeth. So she's coming back to have 4 wisdom teeth removed, 3 or 4 other teeth removed, and doing bone grafting. This is the same exact patient as I said earlier in the show. This is the one that she had the tooth with the root canal. I ended up encouraging her to not to remove that, because she was ready to even lose that tooth. I ended up encouraging her not to remove that tooth, but she's coming back for the rest of the teeth.
That's
So
awesome.
great
That's a wonderful
story. Yeah,
story. Yeah.
thank you. Yeah.
Um, okay, so uh, good morning, doctor. This was written this morning, it looks like. So I really appreciate your time and attention. I wanted to ask about my dental situation. I've lost most of my teeth because of a gum issue. Is it possible for me to receive dental implants?
So what the viewer is asking is, and she has already lost all the teeth due to gum disease, and it is very possible she may be thinking in her mind, oh, I already lost all my teeth because of my gum disease. Am I a candidate to receive dental implant? Absolutely, you are a candidate. Think about this, right? Many people lose their teeth because of gum disease, and if you do not know,
Mm-hmm.
about uh, about 30% of the Americans are, which is one in every three American that you see on the street, they have gum disease that you may not even know. So people are going to end up losing teeth against the gum disease. And you are definitely a candidate whether you lost teeth because of gum disease or any other disease. For a fact, you can definitely receive dental implants. And that's one of the most common reasons why we do dental implants at ToothHQ, by the way, because people are being treated for gum disease, and when they have extensive gum disease and we cannot really help them with the teeth. Going back to the same patient that we talked about earlier, she is going to end up losing 3 teeth. Then we are going to do the bone grafting this time because of the extensive gum disease she has, and then we'll go back and replace them with the dental
Yeah.
implants.
Dental implants have made it so people don't have to be in regular dentures anymore. Like they have the option of having something more permanent, which we didn't have years ago. My
Absolutely.
parents, just a quick story about my parents, were both in dentures by the time they were 30 because the dental um, information about how to take care of things was not as prevalent as it is now. And we didn't have people like you who like to teach it. And so my parents ended up in dentures when they were young, and they hated their dentures their my whole life.
Absolutely. Yeah, you're absolutely right. We call this as the dental implant. They look, feel, and function
Hmm.
like a natural tooth. You can see just by looking at it which one is a dental implant. If you remove this, and that's a dental implant right there. And we always say that even sometime as dentists we can't see, we can't say which of that tooth is a dental implant unless we take an x-ray. So
Hmm.
they are the closest replacement to the natural teeth,
Yes,
and they look, feel, and function like a natural teeth. So absolutely go for it. Dental implant is
absolutely.
the best way to
Yes.
go.
All right. What are the risks and benefits associated with tooth extraction, and what alternatives should be considered?
Um, what are the risks associated with the dental extractions, and what alternative option you should be considering? Um, if you are needing a dental extraction, and there is no option to other than leaving the tooth and let it come out on its own. If you are needing that tooth to be removed, and for variety of reason, either gum disease or you have extensive cavity, if you needed to have it removed, you need to have it removed. And there, of course, I've been doing this for the last about 30 years, and there are going to be a risk associated with any procedure that you do. I always, tell my patients, and when they came here, they drove the car. Hey, what guarantee that you are going to reach here safe, right? So, of course, you're going to take a risk, and then, those risks, they're not common, so we can talk about risk all the time, but it's not common to the degree that you may be overthinking. That's what I'm going to say, that there are like very minimal risk associated with the dental
Hmm.
extraction. Absolutely go for it. Your dentist should be able to talk about the risk, unless they are kind of wisdom teeth lying really close to the nerve, just like the other viewer was talking about. So there are very minimal risk other than on removing the regular teeth.
And most dentists don't want to take teeth out. They would rather try to keep you to save it if they can. So
Absolutely,
usually the
yeah.
extraction is the last option as far as treatment for a tooth. So
Absolutely
your
correct, yeah.
dentist should be able to let you know if it is not salvageable. That's why they're doing the extraction.
Yeah.
So.
And going back to what we were saying earlier, you
Hmm.
don't want to leave the infection.
Right.
Going back to the same story, the 23-year-old
Hmm.
that we were talking about, and her question was, she has been told by her mom that whenever you leave infection in the mouth, and the infection is going to cause brain damage. And you probably are aware that a footballer, an NFL
Uh-huh.
player, dying less than like about a couple of months ago. If you guys now not read the news, go read the news. And I forget his name.
I
Uh,
forget it too. I have it on my desk
yeah,
and I
I have it
forgot.
on my desk too. I forget his name. Just Google NFL player dying from a tooth infection. You will read that. So the dental infections can become really serious. So
Yeah.
absolutely take care of your teeth. Yes.
Absolutely. That's the key right there is just take care of it. Just get rid of the infection in there.
Absolutely.
All right. Is it common for patients to experience sensitivity after a filling, and how can this be managed?
Um, you can absolutely get sensitivity after any type of dental procedures. It could be as simple as a cleaning or a deep cleaning or a filling or a crown or a root canal, or you can be having sensitivity from any of these dental procedures. So whatever type of dental procedure that was done to you, talk to your dentist. That's my best recommendation. It could be as simple as you need like an anti-sensitivity toothpaste, or if the sensitivity is in the form of kind of a little bit of a discomfort, you may need the tooth to be adjusted or like kind of a little bit of a filing to be done. Again, talk to your dentist and they should be able to help you. Yeah.
All right. What are the advantages and disadvantages of dental veneers compared to other cosmetic dental procedures?
Um, so the dental veneers are like in our office, as you know, Lynn, we do non-invasive, right? Non-invasive gum treatment, which is in the form of laser gum treatment. So if you are looking for some type of a cosmetic procedure, which in a least invasive way, then sometimes we call it as even prepless veneers. It's almost like putting in, like, imagine wearing a shirt right on the top like of your skin, that if you want to cover your skin the same way, if you want to cover your teeth, you can put, like, we even will call it as a prepless veneers. So veneers are the most the least invasive
Mm-hmm.
option. And to answer your question, what are the disadvantages, right? Or what are the other treatment options? What
And
are the
just
other?
disadvantages and advantages
Yeah.
compared to other
So the
treatment.
disadvantage of that is the advantages, like it's the least invasive option. The disadvantages when you are doing veneers, and sometimes they may have, particularly if you are a grinder, when you grind your
Mm-hmm.
teeth like heavily, then they may have a tendency to come out. So again, talk to your dentist and they should be able to help you. And whether you are a candidate for the veneers, if you're not a candidate for veneers and there are any disadvantages, for example, if you grind your teeth, they may recommend other alternative treatment options, or you may still get the veneers, but they will follow through with giving you what we call it as a night guard.
Right. And for you ladies out there, the other way to know what it is kind of like getting your nails done. If you do acrylic nails, you put your nails over the top of your own nail. Same thing with a veneer. I have veneers. I've had veneers for 20 years. So I have some and nobody knows.
So are you talking about your nails, or are you talking about true
I've done my
veneers?
nails for 20 years too. So so nails and teeth,
Yeah,
that's me.
there we go. Oh, by the way, we don't do nails, guys, so don't come for the nails here. Talk to Lynn and she should be able to give you the recommendation for the
Right?
spa she
But that's a
goes
good
to.
way for women to understand what it does.
There we go.
So
Thank you for the analogy. Yeah.
you're welcome.
I'm going to make sure that I'm going to mention that on the next book I'm writing on the analogies and the
Oh,
communication for
okay.
the dentist.
Okay.
Absolutely. Yeah.
All
It's
right.
on the works, guys. Yeah. Yeah.
Okay, so the next question is, can misaligned teeth be corrected without traditional braces? And what alternative orthodontic treatments are available?
So definitely it can be corrected with the traditional braces, and lot of options available nowadays. What we call it as a Invisalign, or some kind of a removable
Mhm.
braces. Again, whichever part of the country you are in, talk to your dentist and they should be able to help you. It could be as simple as wearing these removable trays, or the Invisalign type of treatment. You could be done like within 3 to 6 months, or so. Definitely talk to your dentist or your orthodontist, and then they should be able to help you. You are a candidate for these type of removable or the Invisalign type braces, and you don't have to worry about the traditional braces at all. And I think we are on time right here,
I
and we
think we
were able
are.
to.
Yeah,
Yeah,
so
all
thank you
right.
for joining us, and we'll see you next time.
Thank you all, and we will see you next time. Take care.
All right, we're
All
all
right,
done.
man, that was a fantastic show. That
It
was
was
a
good.
fantastic show. Thank you. I think we covered it all.
I think so. I think we just
Fantastic.
we just didn't get to the last two questions.
Well, we are always going to have extra
I
questions.
know, but I mean
so-
that's the first time we've ever gotten that far.
Yeah. So we did-
Yeah, and we
all
still
right.
threw in some other stuff,
Yeah,
so that was good.
fantastic. Yeah, all right. Very good. So we'll clear it up in the morning then. Yeah.
Yep.
Fantastic. Yeah.